Hello everyone, welcome to LOM Special Lecture Series featuring ear seed acupressure and auricular therapy. Day 2 of 4, ear acupuncture. Before we start, take a look at the pictures belonging to that of a patient with back pain for the past 25 years. On the left side, you see the picture of a patient's right ear with bulging disc in the lower back. Condition was confirmed by MRI, and the pain is on the left side of the back. On the right image, it's still the same patient's left ear, no anomalies, and patient is not experiencing any pain on the right side. Ear acupuncture can be a very effective method for relieving acute pains and chronically stiff joints. Sometimes these have been cured within minutes. For some problems, it can be more effective than body acupuncture. Ear acupuncture is easy and safe for self-treatment and in healing groups. Organ diseases and glandular disturbances may respond less dramatically, but ear needling will always be very helpful as a supportive method with other forms of treatment. The main disadvantage of ear acupuncture is the requirement to find the most painful spot for it to be fully effective, and this is not pleasant for people who are very sensitive to pain. The best points are those that feel like an electric shock or like hitting a raw nerve. However, often the pain will be felt as being beneficial, especially because it usually decreases with continued needling. This pain may be considered as letting off steam or congestive energy from a target organ through the safety valve of an ear point. However, chronically weak organs may also benefit from ear needling if no pain is felt in the corresponding ear point. Generally, however, you may follow the rule, the more sore the point, the more effective the treatment. Find the most tender spot in the appropriate reflex area of the ear by pressing with a toothpick or a similar probe. Insert the needle to about 2 mm deep. It must not pass through the ear. Gently move it around to find the correct depth and direction of the sorest spot. If it is very sore, do not move the needle. When the pain subsides, start to twirl it gently between the thumb and forefinger. The less pain there is, the faster you may twirl the needle. If it is not sore anymore, move the needle to a different angle and twirl, and in this way gradually work around in a circle. If all or most of the pain is worked out, withdraw the needle and select another point. If it was sorer in a particular direction, insert the needle at a point 1 to 2 mm away from the first point in that direction and repeat the twirling and probing in different directions. Often, the pain shifts around over a reflex area, and you must insert the needle and work out the pain in several points lying close together. When the ear point is sore and still in need of treatment, the needle will feel like sticking when it is twirled, while it will move freely when the tension is worked out. For treating chronically weak body parts that do not have sore ear points, select the appropriate point or area from the ear chart and twirl the needle rapidly. Each ear contains a complete reflex map of the body as shown in the chart. Instead of using needles, you may press the ear with the head of a pin, a toothpick, a matchstick, or a fingernail. Treat the indicated organ points or wherever there is a tender spot. Press for a minute or more each day or whenever convenient. It will be very stimulating to the whole body to massage both ears thoroughly by rubbing them between thumb and index finger simultaneously. Massage daily. Pulling the ears at different angles is also beneficial. If a problem is not confined to one particular side, for example, patient has insomnia or a menstrual disorder versus a right-sided shoulder problem, treat the right ear in a woman and left ear in a man. Which side of ear to treat? This treatment protocol corresponds to gender in Oriental medicine, where right side and females are considered yin and left side and males are yang. Use this approach provided there is no surface or visible pathology that would contraindicate treatment. For example, rash or skin irritation on that side of the ear that would preclude treatment at that location. If problem is musculoskeletal or pertains to particular side of the body, treat same ear as side the problem is manifested on. For example, if the patient has right-sided knee pain, treat the right ear. There are times when opposite ear works better. For example, patient may have left shoulder pain in the area of LI15 because LI meridian's divergent channel exits from LI15 and crosses as it traverses to the face. The right ear may be more effective. Contralateral needling is useful in both body and ear acupuncture. After treating the patient with needles in one ear during a session, you then choose to affix pellets or other modalities to reinforce that treatment for take-home purposes. Treat the opposite ear so as not to irritate the ear that was needled. Consider patient lifestyle variables or condition of the ear. For example, if the patient sleeps exclusively on one side of the body, has a job talking on the phone for long periods, and primarily uses one ear, or has a hearing aid, multiple ear piercings, or jewelry that is difficult to remove, select opposite ear to treat in these cases, or do not treat at all. When the patient returns for the next treatment in a series, alternate ears and use the opposite ear in order to reduce irritation and chances of infection. The complaint and its manifestations or pain may disappear in seconds. Problem may take a few days to resolve if the disorder is organ problem. Condition may worsen in sensitive patients. Depending upon symptoms, this aggravation may constitute a healing crisis or the therapy may not be suitable for the patient. Acute disorders tend to improve faster than chronic ones. Endocrine disorders are most likely interrelated. Hence, several points that affect endocrine system are required in a prescription. Diseases of yang organs tend to heal faster than yin organs. Because yin organs are solid in nature, they are more difficult to heal. Regardless of modality chosen, patient can feel tired after treatment. Allow the patient to rest in your office so he does not leave in a mentally or physically drained condition. Auriculotherapy is a favorite method for treating elderly or those who like added reinforcement and or extended benefit when treatment, as well as for treatment of musculoskeletal and internal organ problems. If there is corresponding body part that is impaired, such as knee or shoulder, that part is mobilized simultaneously with vigorous massage or needling of the point. The therapeutic effect is even better. Because of reflexive property of the ear, spontaneous reactions may appear on the auricle when there are disorders of the internal organs or other parts of the body. Such reactions include variations in shape, color, size, sensation, appearance of papules, rashes, discolorations, increased tenderness, or decreased electrical conductivity. Points that are pathological have decreased resistance and hence increased electrical conductivity. Nausea, wincing sign is confirmatory of exact ear point, interpolated by voluntary movement of legs, arms, and head. Ear diagnosis advantages. Allows for early detection of illness or disharmony, including genetic predispositions. Offers a rapid means for diagnosis of a disorder. Corroborates existence of an illness. Monitors pathological deterioration or improvement of a disorder. Ear diagnosis can be conducted in three ways: through inspection, palpation for tenderness, electrical detection. The physician can incorporate ear diagnosis into the physical examination, along with tongue and pulse evaluation and other methods of diagnosis as a way of learning more about the patient. Prior to ear diagnosis, do not clean the ear with alcohol, as this procedure changes manifestations in the ear. Ear cleansing removes pathological suppurations or scales, or changes the electrical conductivity of the ear. If you see an abnormal color in the ear, it is probably a positive pathological sign. Try to coordinate it with your other diagnostic data. If you are not sure the pathology visible in the ear is accurate, press on the point with the ear probe. If the color does not disappear upon pressure, which it most likely will not, it is pathological. If the point is tender upon palpation, tenderness additionally confirms that the observation is pathological. In performing ear diagnosis, carefully and systematically scan the ear from top to bottom, from medial to lateral, and from front to back. Remember to inspect the back of the ear as well as the underside of the tragus, antitragus, and helix. Peruse the ear looking for the most common presentations of ear pathology found in charts. Make a list of your findings on your diagnosis form. As the patient's condition improves or declines, ear pathology changes as well. According to the law of the unity of opposites, the yin-yang theory, conventionally ear diagnosis is initially performed on the side of the body that corresponds to the patient's gender. Since right is yin and relates to females, ear diagnosis is performed on a woman's right ear. Since left is yang and male, ear diagnosis is performed on a male's left ear. Pay close attention to any anatomical morphology you see in both ears. Such morphology can indicate an existing condition or a constitutional tendency and allows for a comprehensive diagnosis. If the patient complains of pain on a certain side of the body, like right-sided elbow pain, regardless of gender, inspect the ear on the same side of the body for pathology. In this case, look at the right ear. Pathology can appear in the opposite ear. This is due to channel and collateral pathways crossing the body at divergent points, as well as bilaterality of 12 main meridians. For example, because the large intestine's divergent meridian emerges from the shoulder at LI15 and crosses over to opposite side of the body, right-sided tooth problems may appear in the left ear at the lower tooth point. Thus, inspecting the ear on the opposite side of the complaint is an option. Ideally, the practitioner inspects both ears in order to learn as much as possible about the patient. Try to connect the pathology you see with the patient's major complaint, accompanying symptoms, other active complaints, past problems, or family medical history. In virtually every ear, there is some pathology, especially in older patients. Data derived from inspection of the ear and the patient interview helps focus one's diagnosis. The more chronic the problem, the more likely the ear morphology will change. For example, chronic musculoskeletal disorders show up on the ear versus short-term problems. For example, a diagonal crease in a certain place on the earlobe is called Frank sign. This particular crease indicates heart disease, stress, high cholesterol. If you see this groove, ask the patient if he has any heart pathology. Ask about high cholesterol, stress, any diagnosed heart problem that he may have or that runs in the family. According to classical Oriental theory, such pathology indicates more than the obvious physical heart problems and covers the domain of functions that relate to the heart in Oriental medicine. Therefore, ask questions such as, do you have tightness in the chest pain, palpitations, profuse daytime sweat, chronic persistent cough, insomnia, memory or concentration problems, or emotional problems? If the patient says no, check his pulse, tongue, and complexion, which also may indicate heart conditions. Characteristics of the normal ear. Normal ears should be similar in size and placement to each other, and should move freely and painlessly when massaged. Ideally, the normal ear is firm but flexible, not too soft, not too thick, or too hard. Prominent and pendulous ears in the elderly are a sign of atrophy and aging, and normal for that age group, an index of their declining qi. Auricles should be free of scales, redness, inflammation, have normal moisture, be clean, of same color as rest of the skin on the body. Helix should have a reddish hue. According to Oriental medicine, the ear is related largely to the kidney. Hence, the condition of the ear tells us about health of the kidney, root qi of the body, basis of immunity. Prior to treatment, clean the ear with 70% alcohol. Normal earwax or dirt will be removed easily. Otherwise, the deposit may be pathological. To use our chart effectively for diagnosis, combine the pathology, like redness, with the point on which it is found, like the lung. to construct the proper diagnosis, which would be heat in the lungs. This simple process of combining the abnormal finding with the point on the ear promotes rapid and accurate diagnosis. Reasoning process over memorization is encouraged so that one is free from memorizing and/or having to consult written lists of pathology. Thus, the practitioner learns to quickly infer clinical differentiation presented in the ear. For example, red signifies heat and heat stasis. Let us say that you see a red mark on the stomach area. This suggests heat or heat stasis in the stomach. Stomach ulcer, excess hunger and thirst, bad breath, acid reflux disease. We should not equate heat in the stomach with ulcer or any other Western illness because as Oriental medical physicians, we differentiate the syndrome, like heat or heat stasis in the stomach, rather than diagnose an illness like stomach ulcer. There are many possible health disorders covered under the proper differentiation of the syndrome versus any one particular disease. This is a unique strength of Oriental medicine, which treats the syndrome pattern. In another case, if the red mark is found on a throat point, diagnosis is heat in the throat. Heat here could take the form of a sore throat in its many varieties: tonsillitis, allergies, postnasal drip, sinus and upper respiratory infections. Ear abnormalities. Asymmetries. Both ears should be symmetrical in shape and similar in size, color, and moisture. Note location of these pathologies. Injury may account for some variation, so inquire about any injuries if there are gross differences between the two ears. Pathological changes can differ from ear to ear because pathology tends to occur in the same ear as on the affected side of the body or on the side corresponding to gender. Generally speaking, if the pathology is found on both ears, the pathology is more chronic. Abnormal color includes erythema, flushing, paleness, bluish-black coloration, brown spots, hyperpigmentation. Erythema or redness is common in the ear. Red areas or marks can occur. Redness indicates heat. Heat stasis seen as inflammatory disease. Consider redness carefully by interpreting heat in relation to where redness is found. For example, red mark on hemorrhoid point may indicate hemorrhoids due to stagnant blood with heat, or red mark on common cold point may mean a wind heat invasion. Flushing colorations are interpreted like red marks. Rashes, if red means heat in the blood or heat leading to blood stasis. Paleness, deficiency of affected area. Bluish-black colorations, cold stagnation. Pale purple, chi stagnation. Reddish purple, blood stagnation. Brown, old blood stagnation. Excess moisture or oozing rash indicates excess dampness in the body. If rash is red and oozing, damp heat. As men age, hair may be found in the auricle. This is a sign of hormonal changes that accompany the decline of kidney qi, which occurs with aging. Amount of hair in the auricle gives us an idea as to the state of the person's kidney qi. Birthmarks can range in color from purple to blue, black, red, or faded brown, viewed as signs and symptoms of stagnant blood. Note where the birthmark is on the ear and then see if the patient has any blood stagnation in the corresponding area or organ of the body. Enlarged blood vessels and abnormal blood color, blue, red, or purple. Inspect the ear for visible blood vessels. Consider color of blood within the vessel. Color differentiation can assist you with understanding etiology and directing treatment. Blue blood in the vessel indicates stagnation due to cold. Heavy pain in the body corresponding to area of vessel and auricle is further indication of blood stagnation due to cold. Red means heat and or heat stasis. Pale purple is chi stagnation. Reddish purple, blood stagnation with heat. Dilated capillaries, varicosities, hyperpigmentation, capillary clustering. Dilated capillaries or varicosities, blood engorged vessels or blood extravasations on the ear. These are varicose veins in the legs or insufficiency of circulation to the hips. Knee and ankle points commonly exhibit capillary clustering. Hyperpigmentation and capillary clustering, which are signs of blood stagnation, are old, unresolved lesions. Boils, blisters, warts, lesions, moles, papules, pimples. Boils or blisters are damp heat or toxic heat in the body. Interpret location of toxic heat by examining the area on the ear where the boil develops. If papules and pimples are red, they indicate heat. If white, dampness. Red moles and reddish-pink warts indicate heat in the blood. If mole is dark brown or black, fire, which is a stronger form of heat. All suspicious moles should be noted and the patient referred to a dermatologist for evaluation. Bruises are indicative of blood stagnation or blood extravasations. Bruises do not develop spontaneously on the ear. If bruises are present, they are caused either from ear therapies or from trauma to the ear. The ear will not bruise with proper application of ear modalities. If bruising does occur, check that you and your patient are applying the modalities appropriately. Dark spots, petechiae. Dark spots also indicate stagnation. Patient may have pain in the area of the body corresponding to the dark spot. Petechiae are small dots that are red or purple. Petechiae indicate heat stasis if red or blood stasis if reddish purple. Depressions, grooves, creases, Frank sign. Depressions and small pore-like structures found on points that are not inherently concave indicate deficiency in the corresponding body part or organ. If spleen area tends to be depressed, spleen qi deficiency is indicated. Lung and heart points frequently are depressed, indicating lung qi deficiency and heart qi deficiency. Frank sign was first reported in 1973 by pulmonologist Saunders Frank. Diagonal crease on the earlobe, detectable especially after the age of 40, commonly accepted as a sign of coronary heart disease even in Western medicine. Frank sign extends from lower blood pressure point laterally on a diagonal. A person with Frank sign is 8 times more likely to die from heart disease than a person without such a crease. Those with crease and established heart disease are 3 times more likely to die from heart disease as those with established heart disease and no crease. Most studies link Frank sign with high cholesterol as the precipitating factor in heart disease. Some authors report an association between anxiety and coronary heart disease. Frank sign can retreat if person's health improves. If the fissure on the lobe heals, then the person is eating a macrobiotic diet. No animal fat, which helps reduce high cholesterol and coronary artery disease. Swelling, edema, puffiness, bloating signify damp water, dilute phlegm or yang deficiency. A prolapse appears on an ear structure as collapsed part or border. Interpret prolapse as a more pronounced deficiency, called in Oriental medicine collapse of the qi or yang in the corresponding area. Common places where prolapses occur are in spleen point, spinal vertebrae points, and antitragus area. When prolapse occurs in the spleen area, lateral border of the spleen point is not firm and intact. This indicates spleen yang deficiency or collapse of spleen qi. When seen along spinal portion of the ear, antihelix screws lacks clear, firm border, indicating herniated discs. Prolapsed antitragus area results in turned down antitragus instead of antitragus oriented firmly upward, as in the case of smart crest. The prolapsed antitragus is seen in cases of weakness and exhaustion. So here you could see examples of a partially prolapsed antitragus and the smart crest. Dry, scaly, leathery, withered skin, skin abrasions, erosions, breakdown, desquamation. Dry skin, which is leathery withered skin, is a common finding. Such presentations indicate yin or blood deficiency. Yang deficiency is also a possibility. Yang is failing to generate fluids and blood. In Western medicine, dry skin may present as psoriasis, dermatitis, or seborrhea. Note the points where the dryness is found to interpret your diagnosis. Skin breakdowns, abrasions, erosions, desquamation can be caused from reclining excessively on that ear. The problem is also related to poor absorption or can be related to other dermatological diseases. Ears that move and are positioned high on the head, ears that stick out, detached earlobes, long ears lying close to the head, small ears. Ears that move on the head and are positioned high on the head means that a person eats excess of animal food. Ears that stick out means the person has yin constitution. Because of this feature, hearing tends to be poor. The ears of many elderly present this way. Mentally, such people tend to have a narrow point of view. Ears that are detached means the person eats more vegetarian food. Long ears lying close to the head mean that the person makes sound judgments. And small ears mean that the person has a limited perspective. Pathology of helix, conchas, anti-helix screws. Circulatory disorders are pathology found on the helix. Problems on conchas, digestive problems. Problems on anti-helix screws, nervous system problems. Red veins on the posterior aspect of the ears. Red veins on the posterior aspect of the ears and the ears are cold are precursor to measles or smallpox. Medium red color, there is slight infection. Purple, average infection. Bluish black, serious smallpox infection. Hard nodules or calculi on the rim of the auricle or helix or on the outside opening of the external auditory meatus. Phlegm accumulations are commonly seen in constipation area and in the stomach. Phlegm ridge in the constipation area means fecal accumulation or constipation. Stomach point extends halfway across the width of cavum concha. Because phlegm can accumulate within the stomach and hence appear on stomach ear point, the end of crus of helix will seem longer than usual, thus making the stomach point look as though it extends further across the concha. The crus is not longer. It is the presence of phlegm in the stomach that gives this impression, which is called the phlegm ridge. To correctly locate stomach point, try the following technique. Put your ear probe on the crus of the helix and slide off the crus with the probe laterally until you fall into a small depression. This is the end of the crus and therefore the beginning of stomach point. Then extend the lateral border of the stomach point halfway across the concha and you have located the lateral border of the stomach point. Fleshy, scaly, painful, crusty lesions. Any ear mark that has color variations to it or any ear growth should be considered suspicious and examined by a dermatologist to ensure that the lesions are not cancerous or precancerous. If the lesions are cancerous, there may be local swelling of the lymph nodes. This possible cancerous condition is not for the acupuncturist to evaluate or diagnose. The ear is susceptible to skin cancer since it is so exposed to the environment and the sun and may not have received adequate sun protection. Instruct your patients to avoid unprotected sun exposure. Remember, due to the concentration of lymph nodes in the ear, infection is increased and cancer can metastasize through these routes. Knots, lumps, bumps, growths, protuberant stripes or ridges indicates chi stagnation, blood stagnation, presence of dampness, phlegm, or desiccated feces. If white or hard in nature, knots or bumps can be due to uric acid crystals, damp or phlegm accumulations. White, hard, long, even, bony phlegm ridge means long-term constipation, whereas if the area has a soft white center, bowel movement may be sluggish. Such lumps can indicate arthritis seen in the neck and cervical vertebral areas or on the rim of the helix. Purple lumps on the uterus point means uterine fibroid tumors. Once you learn how to differentiate these pathologies, you can safely treat the underlying disorder that causes their development. If you are unsure as to the nature of the growth, refer the patient to a dermatologist, gynecologist, or other medical specialist for proper evaluation and treatment. Scars on the ear caused by injury to the ear may produce energy disruption in corresponding body areas. Injury to a body part or organ removal may appear as a small crescent-shaped scar in the ear. Shriveled, shrunken ears means decline of qi and overall weakness. Thank you very much for listening.